My name is Rachael. I'm a senior clinical nurse and I cover two wards at Addenbrooke's Treatment Centre. We're responsible for the standard of care on the wards, for the patient experience, for the environment and for providing clinical support to staff. For me, it's about being with the patients and about spending time with patients and making what for them can be quite a traumatic experience a good one. It's difficult to explain, I think, sometimes, but holding somebody's hand or just using one word can make all the difference to a patient. You come into hospital, you're vulnerable. That power that you normally have over your own life is taken away. But I think we're there to give it back to them. I think you have to want to do it, because when you're working on the wards, when you're working with patients, you're working with people, they can pick up on whether you want to be there or not, and I think that's really important. I did art GCSE and I loved it and it was great, but it's how easy is it to forge a career? It was something that I enjoyed. I didn't want to turn it to something that I didn't enjoy. It wasn't really until my A-levels that I thought about nursing, so I was kind of still in two minds, not really sure. I was kind of open for, whatever came along, I think. The year before I started my training, I'd actually looked into being a guide dog trainer. And I have absolutely no idea why, but I just thought I would. I suppose I changed my mind and thought about nursing, and my mum actually tried to talk me out of it. She was just kind of just like, oh, well, I don't think you should. So I kind of didn't feel that she was that supportive. But certainly, since I've qualified, she has been. The chief nurse in my last trust, for me, was very inspiring. With her, it was always the small things, the attention to detail. She was always focusing on those small things, and I think that's somebody has inspired me, definitely. I chose to join the NHS because it is such a fantastic organisation. We're one of the only countries that's got a free healthcare system, and there's so much opportunity, there's so much happening for the NHS now. I wouldn't want to work for any other organisation. When I first qualified, I'd always said that I wanted just to stay, as a staff nurse working on a ward. I think what made me want more than just that was because I could see the way nursing could influence change and positive change for patients. So that made me want to aim higher. I got to ward manager's level, but but I can see that there's more things that can be done and there's more things that I want to do. That's what's, I guess, got me to where I wanted to be now, I suppose. As I'm doing what I want to do, I feel more comfortable, more confident, and I think that changes the way you perceive things and the way people perceive you as well. I guess it's made me realise that the choices that I made and what I wanted to do, they were the right choices. I think what excites me is if you can make somebody smile when they're having surgery for cancer, and that can be for one moment, that's what I get out of it. And that for me is a huge thing. And then if I can inspire, junior staff to want to do the same thing, enabling them, and giving them the power to do the same things, and that's what I get out of nursing.